Today, we are going to be talking about injuries and illnesses. These topics, while they might not be the most exciting, are necessary for anyone involved with horses. Although horses are very big animals, they are extremely prone to problems, even more so than a smaller dog or cat. Knowing the basic injuries and illnesses can be very helpful in treating injuries, recognizing emergencies, and knowing when to call the vet. Rain rot, also known as rain scald or mud fever, if it is on the legs, is a bacterial infection. Normally, the bacteria lives on the horse's skin without causing any harm. However, if a horse is wet for long periods of time, the skin becomes oversaturated and allows the bacteria to creep deeper. The mixture of dirt and water creates rain rot, and because of this, it is more common in tropical areas with a higher humidity. Rain rot can be easily diagnosed by the bumpy hair that sticks up, and when removed, the tufts of hair resemble the end of a paintbrush. If allowed to progress, rain rot causes loss of hair and bare patches of skin. It is also painful to the touch and highly contagious from one horse to another. The best method of treatment is to remove the scabs and tufts of hair and bathe the horse with an antibacterial shampoo. In extreme cases, antibiotics given from a veterinarian may be necessary. The best thing to do is prevent rain rot from starting in the first place. Whenever possible, give the horse access to somewhere out of the rain. This could be a stall, a run-in shed, or trees. Regularly grooming and bathing are also great ways to prevent rain rot and keep the skin healthy. Hives are groups of itchy swellings in the skin of the horse. They often develop and disappear suddenly. They are elevated, round bumps and can be anywhere from half an inch to 8 inches in diameter. Hives can develop on any part of the body, but occur mainly on the back, flanks, neck, eyelids, and legs. In advanced cases, they may be found in the mouth, nose, and eyes even. In severe cases, the skin eruptions go along with fever and a poor appetite. The most common causes of hives are allergies, insect bites or stings, medications, and sometimes vaccines. Episodes of hives that quickly come and go are usually caused by inhaled allergies such as pollens from trees or plants, dust, rust, molds, and feathers. Hives can be a one-time occurrence or they can be chronic, which means that they keep coming back again and again. The first step of treatment is to identify the allergens that cause the hives and eliminate them from the environment. In the case of pollen allergies, where the allergy cannot be removed from the environment, a vet may give injections to desensitize the horse to the allergy. Ringworm, despite the name, is caused by a fungal infection. It appears as round, crusty areas on the skin with hair loss. Unlike the last two conditions, ringworm does not cause itchiness, but it is still painful. Ringworm is allowed through the skin by open wounds, and the fungus that causes it is commonly found on barns and fencing. It is also contagious from one horse to another and can appear even 2 months after exposure. The good news is that ringworm is most common in horses under the age of 5. Older horses tend to build an immunity to the fungus. Treatments include antibiotics and ringworm-specific shampoos and sprays. Because ringworm is contagious, it is important to clean everything the horse touches and keep it away from others until the infection is gone. In hot and humid climates, particularly in Florida and around the Gulf Coast, many horses have a condition called anhidrosis. This condition is defined as a decreased ability to sweat. Sweat is caused by a hormone known as epinephrine. In horses with anhidrosis, the effect of epinephrine is dulled and less sensitive. These horses will produce some sweat, but not the correct amount for their body temperature. Horses use sweat to lower their body temperature by 65 to 70%, so a horse that cannot sweat is at a much greater risk of overheating and having a heat stroke. Researchers have not been able to find a cause for anhidrosis, but they do know that it affects between 2 and 6% of horses. And horses that are moved from warmer climates into cooler climates often start sweating like normal. There is no treatment for anhidrosis other than keeping the horse cool with fans, air conditioning, and lots of water. Horses have one of the largest eyes of any land mammal, but despite this, eye problems are not very common. There are a couple signs that a horse might have an eye problem. If there's anything not normally in or around the eye, if the eye is watery, red, cloudy, or if the horse excessively squints, blinks, or otherwise acts in pain, these are all reasons to call a vet for an eye examination. Okay, so if your vet is going to come out and do an eye examination, if there's a question on if your horse is blind or if they have vision problems, there is a couple different vision tests that your vet will do. One of the old methods was that you would just kind of wave your hand in front of their eye, and if they blink, that means they have vision. That method is kind of unreliable because a lot of horses will blink even if they don't have vision just because they feel the air going past their eye. So that method is not super reliable. We're going to show you a better one. So the reason that Leo is our example today is because he actually does have an eye problem. So if you look at this eye, it's pretty normal. It's your average eye. And then if you look at the other side, it's kind of blue and cloudy. Also, if you look from the front, you can see how this eye has a nice shape to it, whereas this one is kind of flat. So most likely with Leo, what happened is that he had some sort of head trauma. Either he bumped into something or he was injured in some way. He probably wasn't born like this, and it was an injury that happened at some point in his life. We think that he still has vision in this eye, but I guess we're going to find out with our vision test today. So what we've done is blindfolded this eye. You have to test one eye at a time. So we're going to start with his normal looking eye. So that eye's doing nothing, that one's resting. This is the eye we're going to test. So what I'm going to do is we have these are Easter eggs. You could use balls or bean bags or whatever. We're going to throw it and see if he is watching it with this eye. And you can see there, he saw that. So definitely vision in this eye. Alright, so now we're going to test his other eye. This is the one that has some issues, so let's see if he follows these. So that one he definitely saw. You could see how he picked up his head and he looked with it. Okay, so that's our vision test, and I think we can say that he definitely has vision in both eyes. Many horses find ways to adapt and still live normal lives with limited or no vision at all.
On the outskirts of Eugene, Oregon, lives Endo, an Appaloosa gelding who has inspired the hearts of many after losing his sight. His disorder got to a critical point at the age of 8, where he was taken to the Oregon State University, who diagnosed him with chronic reoccurring uveitis.
Good. Canter. Over. Canter. Canter. Good. Bow. 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 Good boy.
Carrying out activities that a fully sighted horse has trouble with makes people realise that the loss of sight isn't the end of the road for an equine.
Ears can have similar problems to the rest of the body. The skin around the ears is delicate and can be prone to rain rot and tumors. Because of this, brushing the outside of the ears and gently wiping the inside with a cloth should be part of the regular grooming routine. It is rare for horses to get things stuck in their ears, but it can happen. Signs of ear pain include head shaking, head tilting to the side, and rubbing the ear. These signs can also occur with an ear infection. So now we're going to do a hearing test. And hearing is a little bit harder with horses because they don't rely on it as much as their sight. So a lot of times it goes unnoticed if they're having trouble hearing or if they are deaf. And it really doesn't affect them all that much the way their sight does. Lots of deaf horses go on to live normal lives, and you don't really treat them any differently or see any signs that they can't hear. So what we're going to do today is I'm going to stand in her blind spot, which would be way back there behind her, and we're going to make some sort of noise to get her attention and hopefully have her ears go back or have her turn and look at me, and that way we know that she heard me and that she didn't just see me. So the way you want to do that safely is to have some sort of barrier between you and them. So what I'm going to do is I'm going to be on the other side of our wash rack here. You could also do it with a stall wall in between you. That way you stay safe in case they do get startled. And then you also just want to do it calmly and just enough to get a reaction, but you don't want to shout or scream or really scare them. So you can see that she definitely had a reaction. She picked up her head more, she put her ears back, her eyes open more, so she definitely can hear. Choking occurs when the esophagus is clogged with food. Horses that choke tend to be fast eaters that inhale their food quickly and do not chew it thoroughly. Choking can also happen to horses that have defective teeth if their teeth are shaped incorrectly, or if chewing hurts, they are more likely to stop chewing and choke as a result. When a horse is choking, they will usually be distressed, have saliva coming out of their nose, and cough a lot. The good news is that unlike humans, horses can still breathe while choking, although a choke is still an emergency and the horse should see a veterinarian as soon as possible. Horses that are choking should not be allowed to eat or drink, as this can make the impaction harder to dislodge. Sometimes a vet will only have to tranquilize the horse and the impaction will pass, thanks to the muscles of the esophagus relaxing and becoming wider. If that doesn't work, the vet will need to put a tube up the nose and through the esophagus. This pushes warm water into the esophagus, which softens the food and helps it to pass. The best way to prevent choking is to have your horse's teeth checked regularly for any dental issues, and for horses that eat fast, you can put rocks in their feed buckets to make them eat slower. A horse's stomach is very different from a human's and has two separate parts. The lower part of the stomach is coated with a thick mucus layer which protects it from the stomach acid, while the upper part of the stomach does not have this protective mucus layer. If the stomach acid is moving around and sloshes from the lower region onto the upper region, this can cause wounds along the inside edge of the stomach, and these wounds are known as ulcers. Ulcers are caused by stress, going long periods without eating too much grain, and overuse of certain medications. Horses that have ulcers can become picky eaters because some feeds will irritate the ulcers. These horses also become irritated when being touched, saddled, ridden, or groomed around the flank area. Treatments include curing the existing ulcers with medications or supplements, feeding regularly, and reducing stress. Here you can see the same horse before and after treatment for ulcers. You can see before treatment that the horse is very irritated and does not want to be touched because it is painful. Afterwards, it's much more tolerant. Colic is the most common medical emergency encountered by the horse owner. Colic is not a specific disease, it is an indicator of abdomen pain. There are many symptoms, although the most common include pawing, sweating, anxiety, watching or kicking at their stomach, and frequently getting up and down to roll. There are many causes of colic. The most common include impaction, which is when the digestive tract is blocked with food or sand. Parasites can also cause it, toxins in the feed, constipation, and if anything in the digestive tract gets twisted or displaced. Colic cases can range from a slight stomach ache to a life or death situation. It should always be considered an emergency and should be treated as quickly as possible. In the case of mild colic, pain medication may fix the problem. With a colic that is moderately bad, vets will give fluids and medication through the nasal passage or through an IV. In the case of a severe colic, surgery may be the only option.